here in the Housing Policy Division. Today we're going to be joined by a technical assistance consultants team from TAC, CSH, and Homebase. Right now, all attendees will be in listen-only mode during the webinar. There will be a question and answer session after the webinar. Next slide, please. Attendees will have two options to ask a question. There is a raise the hand feature that will come off of mute, so you can be able to speak directly to us. In order to raise your hand, the hand feature, you must have entered your audio PIN when you first dialed in. If you did not, fear not. You can use the question box on the left-hand side of your screen. There is a viewer panel. You could be able to see the handouts to this webinar, and then also you can also be able to ask a question. Next slide, please. So for today, we will cover the following. So we will provide an overview of HCD's technical assistance. We will be able to provide you an overview of the technical assistance request forms, and then also just give you a little snippet of the technical assistance open house forums. In addition, you will be hearing from our technical assistance consultants, building capacity category. That will be a technical assistance collaborative, and you'll hear us say the word TAC. And then for housing stability, you will hear from Corporation for Supportive Housing, and you'll hear CSH. And then with Homebase, that is the Center for Common Concerns, we'll be providing housing first overview. We also will allow for some time for Q&A at the end of the presentation. Let's get started. Next slide. So HCD is pleased to offer technical assistance to California counties and COCs to help you develop and build capacity and improve the delivery, the design and the delivery of programs and services for people who are experiencing homelessness. The technical assistance is offered to you in three distinct categories. One is capacity building, the second is housing first, and then the third is housing stability. So once HCD receives the your technical assistance request form in any one of the categories, so if you're seeking to create or update your homeless plan under the capacity building, then the technical assistance provided could include any of the following. So we could provide you an in-depth or remote on-site assistance from our homelessness technical assistance consultants. We could be able to provide you with how-to guides, some online, maybe by providing you some online resources or toolkits or frequently asked questions, developing frequently asked questions. We could also be able to provide you with interactive training for your stakeholders, knowledge building for your staff, either through online courses or a webinar, or we could set up a regional workshop or a peer-to-peer learning session. Next slide. So I will give you a summary of the technical assistance. And so the program derives its funds from leftover funds from the No Place Like Home technical assistance funds, and then also a portion of the California Emergency Solutions Grant Program technical assistance portion. Again, these were the state funds that were provided in 2016. That amount came up to, we combined that amount to come up to $2.175 million, and that will provide approximately 13,000 hours of technical assistance at no cost to your jurisdiction. So I have done all the procurement. You do not have to worry about procuring the consultants. So the recipients are California counties or continuums of care that are eligible for either both the ESG program or the No Place Like Home program. So with the ESG program, we have provided awards to all 43 COC continuums of care in our state. For the program goals, we have lofty goals that we would like to meet. We definitely would like to complement your jurisdiction's efforts on your current TA efforts. Would like to also streamline the technical assistance opportunity where feasible. So we've been reaching out to HUD to find out what technical assistance that they're providing in the field, and our goal is to try and see whether we can be able to complement the technical assistance that you're receiving. And then we would like to reach at least 50% of all eligible recipients within the first 12 months. So again, this is a really lofty goal, and I think that with your help, we could be able to provide technical assistance in the field. So as I mentioned earlier, the Technical Assistance Collaborative Incorporated will be providing building capacity, and they will later on they will be able to provide you a little bit more about themselves. And then Corporation for Supportive Housing will be providing housing stability, and then the Center for the Common Concerns, we know them in California as home base, will be providing the housing first. Next slide. So since we have established this technical assistance, 1 month in, we've actually received 10 requests for technical assistance, 5 for building capacity, 2 for housing first, 3 for housing stability, and we have committed already to 842 hours. So there is plenty of technical assistance to go around if you're thinking about submitting a request. We do have those open house forums. We just concluded this last one in San Diego on 2/20. So folks, if you attended that open house session, thank you for attending. We also ask if you could also fill out that evaluation survey. And then we're having the webinar today, and then we will be going out to the field to Merced, to Sacramento, and then to Oakland on the dates provided on your screen. Next slide, please. So we are using, the way that we're unveiling this technical assistance is a little bit different than we have our other programs. So we are using the similar method that we had with HUD, which is an on-demand model. As I mentioned earlier, HCD announced the availability of this technical assistance at the Homeless Coordinating Financing Council. That was on January 17th. And at that meeting, our director also made a commitment to Butte County to provide dedicated technical assistance for their team, especially as they're recovering through the worst disaster at least in our California history. Counties and COCs will submit requests through the HCD's website. Our staff will evaluate the request for completeness and eligibility, and then at that point we will assign the technical assistance, your request, to the technical assistance consultant. So you may have 1 or 2 things that may happen. You may have the technical assistance provider call you to ask clarifying questions, or if the information that you have submitted is sufficient enough to develop a work plan report, then we will go ahead and schedule an introductory call with the technical assistance provider. HCD will approve the work plan, deliverables, and expectations, and then will approve the technical assistance to be deployed to your jurisdiction. We do intend this to be an interactive engagement, and so we ask that we will be conducting regular check-in calls, both with yourself just to see how things are going, and then again with the technical assistance provider just to make sure that we are still meeting the goals and outcomes that are outlined in the work plan. Our goal, again, is to be able to help you with your systems improvement, to help you build healthy homelessness systems, either through housing stability, housing first, or building capacity in any of the menus that we've offered. And then the technical assistance consultants, once they have finished their engagement, they will submit a report of the technical assistance provided. At that point, we will ask you to also evaluate the technical assistance provider and then send us any feedback so that we could improve in our next engagement. Next slide, please. So on the HCD Technical Assistance website, where can you be able to find the technical assistance request form? So on our website, if you scroll down to the technical assistance activities, you will find the request form for each of the categories. So that's capacity building, housing first, and housing stability. And so you will just click on that form, and it will lead you to the next. Next slide, please. It will lead you to this next screen where you will see where it will see the in this example it's a capacity building technical assistance request form, and you will see this screen. HCD is committed to respond to your request within 1 to 2 weeks, but again, depending on the complexity and the breadth of your request, we will let you know, we will inform you if we need if we cannot be able to meet the additional time, or if we need additional time. Next slide, please. So the technical assistance form will ask you for some demographic information. We'll ask you for your collaborative applicant. We'll also ask you for an alternative contact, just in case the primary contact is not available. Next slide, please. And then this is where we'll ask whether your organization is receiving technical assistance, whether you're receiving from HUD or another federal agency, or whether you have actually hired another consultant to assist your agency. Again, this engagement, we're looking to see whether this engagement could complement your existing efforts. Next slide, please. So when you go into the building capacity request form, you will see this menu of options. So if you're seeking to receive assistance on unrelated activities, then you will be asked to choose your most pressing needs. So for example, if you would like to update your homelessness plan, but you're also looking to increase HMIS participation to more providers in your service area, then you will be asked to indicate your most urgent need. On the other hand, if you submit a request, you could pair your request to ask for more than one selection. So you could you could request to evaluate your coordinated entry system and implement your coordinated entry system. Next slide, please. So for the housing stability request, we're asking your agency to rank the order of your request. As you can see, the selections are broad, and so this information is critical for us when we're developing your work plan. Next slide, please. So for the housing first technical assistance, we are asking you to select either one of the first 3 options. However, if you're looking to create a training manual for your street outreach or your case management or your housing navigation teams, or in the event that you're looking to create a communication campaign to dispel the myths around implementing housing first, then this is where we encourage you to use the other. So when we're asking you to specify what you request, then we're asking you to use the other box, or to check mark the other box and describe your request. Next slide, please. So the technical assistance I believe the technical assistance engagement is a partnership between your staff and our HCD technical assistance team. At the initial calls, we will ask you to indicate your dedicated staff who will work with your HCD TA team. So think of the HCD TA team as an extension to your staff. Question 10 is really crucial for us as we're trying to respond to you efficiently. We're asking you to just provide as much information as possible and be concise in your description so that we could, so that our team could develop the work plan. Next slide, please. And then for question 11, we're asking you to describe the goals and outcomes that you would like to achieve as a result of the technical assistance. We're also using this as a measure on how successful the technical assistance, how successful the technical assistance engagement is. And so we would ask you to give us as much detail as possible, and also looking to make sure that that the plan is communicated, if it's to your COC members, or if it's to your staff, if it's to your county staff, then we're asking that the goals and measures are communicated to your other staff. And then for question 13, we're just asking that if you're seeking to update your policies and procedures, then we're asking you to also provide your draft plans, strategic plans, or HMIS policy or governance charter, so that when we're developing the plan, that we have the most information to develop the plan. Next slide, please. So, I know that you are all attending this webinar, but then I still believe that the face-to-face interaction with our technical assistance providers in one room will also be beneficial for your teams. So, at the open house forum, this is the format that we propose, that we will have. We will have 6 different stations. We will have the HCD homelessness programs, where we will be answering general questions on TA, or providing some technical, answering any technical questions that you have on specific homelessness programs. We will also have a member from the Homeless Coordinating and Financing Council, that's Lahela Madoff. She names herself as a HIP lady. She will be available at one of the stations, providing office hours, and also answering any questions on the HIP program. And then we will also have our technical assistance team. So we will have building capacity on top, and then because of obviously the nature of where we're going in our state, we will also have disaster recovery and preparedness station. And then we'll also have obviously the housing stability, and then housing first by both the CSH and the home-based team. So the open house forum locations are in Merced, Sacramento, and Oakland. And then for more information, please review our website. It does have the exact locations, the exact detailed locations. So we hope to see you there. Next slide, please. So who should attend the open house forums? So we're asking that your county staff, your community development and your behavioral health staff administering your homelessness program, so your rapid rehousing, if you have established a flexible housing subsidy pool, we will have that expertise in the room. If you're looking to develop your diversion program, or need some help with implementing your diversion program, then our folks in the room will be available, including CSH, who is an expert in supportive housing. And we're also asking that your housing authority staff, if they engage in any one of those programs, are also welcome to attend. And then for the continuum of care, if you have your coordinated entry system planning team, your collaborative applicants, your HMIS administrator, your data team, your planning team, your subcommittee, your work group members, if you feel that it fits in with any one of the offerings, we ask that they actually come in and they actually talk to our technical assistance providers. Next slide. So with now, I will hand it over to Gina, and she will be able to give you more a better description of the capacity building technical assistance.
Great, thank you, Kathy, and thanks everyone. Good morning, and thanks for joining us today on the webinar. I think we mentioned this in the beginning, but I just want to remind folks that the webinar is being recorded, so folks who are at your agencies that weren't able to join can listen to it at a future time as well. So my name is Gina Schack, and I'm from the Technical Assistance Collaborative, or TAC. And we are, as Kathy mentioned, we are the agency that will be providing the capacity building part of the technical assistance that HCD is offering to COCs and counties. Next slide. Just a quick little bit about TAC. We're based in Boston, Massachusetts, but we have staff all over the country, and we work all over the country. We've actually worked in every state over the last 25 years that we've been in business. We're a nonprofit. We essentially have two practices of business. We have a human service side and a housing side that really looks at, both sides of it look at housing systems to implement policies and practices that empower people to live healthy lives in the communities of their choice. And as folks know, there is a natural intersection between housing and human services when it comes to helping folks who are vulnerable and homeless and at risk of homelessness or at risk of institutionalization. So as a team at TAC here, we work, our practices are very braided together. For roughly 25 years now, we've been working with local communities, states, units of local government, and we also have our federal partners that we provide technical assistance to through contracts as well, to really help folks who are working in the homeless crisis response system and to identify resources to help folks decrease their length of time of homelessness and ultimately, ideally, eradicate homelessness in your communities. Next slide, please. So as folks all know, and we've seen this a lot more recently in the way we have approached ending homelessness from the federal government down to the actual communities and staff. But the idea is that your homeless crisis response is a system, and there are just sort of overarching goals or best practices that are common within a crisis response system. And sort of each one of these bullets fall under those system goals. Right. So the idea is that folks who are in crisis have there's an immediate access to them for them to have a safe place to go, and even when there isn't an emergency shelter or some kind of the traditional resources in place. The other idea or goal is that people are never unsheltered. There's also the idea that people don't spend a long time in homelessness and they have access to help reconnect to housing. And people exit homelessness quickly and don't recycle back in. So it's essentially the idea that homelessness is rare, brief, and non-reoccurring. Next slide, please. As I was saying, it really is a response. Your homeless crisis response, it works as a system, right? And the idea of the system is to end homelessness, reduce the number of people experiencing homelessness, improve your system performance outcomes, because that'll make your system more efficient, use funding to more effectively look at your system and to improve system flow or to be able to see where folks are essentially getting stuck, and I put the word stuck in quotes, not letting people get stuck at certain parts of your system. So essentially, these elements of a strong homeless crisis response system tie back into the technical assistance that HCD is offering. So I'll talk quickly about the elements for the strong system, but what the technical assistance will do is ideally help strengthen those elements to make your systems as strong as possible. So the housing first approach across your systems, not just program-centered, but across the system. The idea that you have diversion within your homeless system whenever possible. The idea that there's a rapid identification engagement of people that are experiencing unsheltered homelessness to connect them very quickly to a crisis response, whether it's a service, a diversion resource, or actual shelter. Quick, accessible, and low barrier pathways to shelter and other crisis safety nets to ensure short stays in shelter. And then the rapid connection for all sheltered and unsheltered people, typically in permanent supportive housing, permanent housing, rapid rehousing. We'll talk a little bit about that. But honestly, with the priority of serving folks who are most vulnerable, who cannot get out of the system or are likely to fall back into the system without your more intensive resources. Okay, so this map essentially kind of outlines what a strong crisis response system would look like, and it's really the idea that strong capacity building equals your effective homeless crisis response system. And I think just looking at it as a whole, you want to make sure your system is set up not linear. So there's a lot of different parts to your system. No one person or one family has the same path, right? The outcomes are the same, that folks are going to get out of homelessness, not fall back into homelessness, and do that very quickly. But the idea that it's linear and everybody needs the same resource is what we've learned doesn't work. So really, a good crisis response system is set up in a way that it's going to make sure that you're serving the right people at the right time with the right resource. So that's what this map is mapping out. So if you look on the left side, you sort of have the targeted prevention and diversion. So that's like essentially you can look at it as more of a phased approach or a dynamic prioritization approach, but that is essentially your targeted first touch into the system. For folks that are having a bigger crisis or need more resources than just a diversion or a prevention light touch resource, then you would start bringing them into your system through a coordinated assessment, through a coordinated entryway to ensure that folks are all accessing your system and those resources within the same way. So as you can see with the arrows, some folks will bypass the emergency shelter or a safety crisis stabilization or a housing search support and go right into permanent housing, which could be community-based permanent housing. And when we say community-based permanent housing, it could include market rate units, subsidized units, so folks with Section 8, so with other kinds of subsidies, and then community-based supports and services, whether it's a Medicaid resource or other local health and welfare resources. In some cases, families or individuals will hit your emergency shelter system and need either have help with crisis stabilization and housing search, and then that family will exit shelter, or that family or individual may exit shelter on their own. Then you have folks that are going to need a little bit more help, right? So that may include a second assessment, a more in-depth assessment, depending on what your coordinated entry system looks like, and that may link folks to rapid rehousing as well as links to services or transitional housing with services. In some cases, rapid rehousing and transitional housing may not be enough, or folks may not be successful in rapid rehousing and transitional housing. And in that case, you would continue to help them along kind of the path into the community-based permanent housing. If you look at the bottom, you'll see the line of families and individuals with the highest needs, or they've also said that folks who are the most vulnerable with the highest needs, typically the folks who have been homeless the longest. There may just be a path that they're identified in the very beginning of the system. There may just be a path for permanent supportive housing. The idea here, again, is that you're not just referring everyone to permanent supportive housing. Well, that would be great if you could, but no community in the country has enough resources to serve everybody that needs housing or facing a housing crisis with PSH alone. So that resource is really looked at for folks who have the highest needs or the most vulnerable family and individuals. Okay, next slide, please. So these next two slides are just sort of the bulleted outlines, and I'll talk a little bit about what each one of the actual interventions can look like and some examples. But I just wanted to run down the list of the types of capacity building technical assistance that is activities that are eligible under the TA. Governance and structure, coordinated entry, strategic planning, performance measurements, disaster recovery, rapid rehousing, HMIS, or Homeless Management Information System. Next slide, please. Youth homelessness, system mapping, and then essentially other aspects of your homeless crisis response system. So it could be helping design your point in time, helping look at your point in time data, identifying or repurposing underperforming projects, conducting a gaps analysis, and making sure that you're not under or overutilizing certain resources. And this would, as Kathy said, this would all be for folks who are at risk or currently experiencing homelessness in your community. Next slide, please. Okay, so this is just a little bit more detail of what each of the bullets can incorporate. But for governance and structure, it can range from us kind of looking at your COC structure, whether it's facilitating conversations and bringing your community stakeholders together, and just figuring out if anybody's missing at the table, looking at your committee structure or membership, or making recommendations based on just your overall system to make it stronger if you feel that it could use some work or it's lacking, or maybe you started your governance and structure and your charter very strong and everybody was coming to the meetings, and then now over the last 4 years or 5 years it's kind of teetered off a little bit. So we could also look at your charter and help revise that. I know folks look at it pretty annually at this point. Coordinated entry, for communities that are still in the design phase, we can help strengthen the design of it. We can help with implementation. We can help with an evaluation of a coordinated entry system that's actually been working for a while and maybe needs tweaks now that you have been operating it over the years, or some communities are still phasing in the coordinated entry. We can help folks bring their systems to scale. Strategic planning. So many communities have a strategic plan, either written or based on writing for based on other funding sources. So we could look at your strategic plan. We can make sure the policies align and resources of providers, agencies, all kind of fit you locally best while hitting what your funders are looking for in strategic plan, but making sure it's unique and to your community or your community needs and its gaps. Next slide, please. Okay, performance measurements. So we could help you look at both the project performance measurements as well as system level performance measurements. Some continuums have, we could help looking at monitoring for collaborative applicants for the subrecipients and recipients, identifying targets aligned with federal goals, and creating tools to really monitor outcomes of the different things. We'd look at your data and your system performance measurements that you report through HMIS. As Kathy mentioned, disaster recovery is something we're also doing. We can also help with, whether it's planning for possible future disasters, or in making plans in place for those, or current recovery efforts. And the HMIS, as Kathy mentioned, the Homeless Management Information System, we could really help communities look at their data, increase coverage, and look at rates of current projects that are entering into HMIS. Next slide. Okay, rapid rehousing. The idea that rapid rehousing is really a system-wide process and not program by program, and helping folks and communities and CSCs strengthen the program design and creating evaluation for your rapid rehousing. And sometimes that has a lot to do with training staff or even getting buy-in from staff. Youth homelessness, we can help work with communities on the strategic planning process around preventing and ending youth homelessness. And system maps are really the idea that we can help look at your system as a whole, right-size that system. If you have a really high number of unsheltered folks, and then you look at your sheltered beds and it's a very low utilization rate, there's probably something going on there. So really looking at the system as a whole and mapping it together. Next slide. Okay, and then I think I mentioned the other aspects in the beginning of this, the point in time counts, identifying other projects, and really conducting, and this would be with the systems map, but a general gaps analysis and looking at where resources are coming from and making sure they're matching the needs of the folks that you are serving currently in your community. All righty, next slide. All right, so that is, a really quick overview of the capacity building technical assistance. We'll have a quick Q&A session after this, so if folks have questions, feel free to ask them. I'm going to hand it over to Kate at CSH now to talk about housing stability TA.
Hi, thank you so much, and thank you everyone for joining us today. My name is Kate Bitney, and I'm a Senior Program Manager for the Western Region with the Corporation for Supportive Housing, or as Kathy mentioned, CSH. Prior to working with CSH, I spent many years working in direct service, everything from street outreach to shelters, community drop-in centers, and doing intensive case management, as well as in program administration with both nonprofit and government. So with that, I'm really excited to be working with all of you that are on the ground, providing these really important services to folks in California and doing such great work. Next slide, please. CSH is a national nonprofit organization with offices and staff working throughout the U.S., including offices in both Los Angeles and San Francisco. Our focus is on supportive housing and housing solutions that improve the lives of vulnerable people by helping to maximize public resources to create more supportive housing solutions to make lasting permanent impact. This ultimately helps build strong, healthy communities. Next slide, please. A good place to start, I think, would be a bit on definitions. So we define supportive housing as affordable housing where supportive service providers actively engage tenants in flexible, voluntary, and comprehensive services, and also work with property and housing management to support tenant stability and ensure that the housing remains a positive community asset for the long term. Supportive housing is an innovative and proven solution to some of communities' toughest problems, and is also the scaffolding for the delivery of more effective and responsive public services. Next slide, please. So CSH has been contracted with HCB to provide housing stability to counties and continuum of care providers who are eligible for either or both the California Emergency Solutions Grant and the No Place Like Home programs. Under the housing stability contract, CSH can work with communities to improve exits from homelessness from various interventions such as diversion efforts, emergency shelter, transitional housing, and ultimately to help improve stabilizing households in supportive housing. Next slide, please. In this slide, I'm going to talk through some of the outcomes that we're looking for when it comes to supportive housing and housing stability. The whole goal of operating quality supportive housing is to achieve positive outcomes for tenants. In general, when we focus on housing stability and supportive housing, we ultimately hope to achieve 5 primary outcomes. First outcome is that tenants stay housed. Housing is designed to break a cycle of housing instability for tenants and ensure they remain in permanent housing. Tenants stay in permanent housing, and this is inclusive of tenants who exit supportive housing to other permanent housing. Outcome 2 is that tenants are satisfied with their services in housing. Tenant satisfaction is an important outcome that ultimately affects the quality of life for tenants and the ability of supportive housing projects to help tenants achieve housing stability. Tenants are satisfied with their housing, and tenants are satisfied with the services that are available to them. In outcome 3, tenants increase their income and employment, or in some cases maintain it. Tenants increase their income in supportive housing by obtaining benefits and/or employment. In cases in which tenants are already employed or receiving all benefits for which they are eligible, they maintain their income. Tenants who have been in supportive housing for 1 year or more have increased their income, and tenants who enter supportive housing with income and/or employment have maintained it. Tenants who express a desire to work are supported and ultimately successfully employed. And outcome 4, tenants improve their physical and mental health. Supportive housing and associated services help tenants to access needed physical and mental health care and improve their overall health status. Tenants promptly receive any needed medical care, including preventive care, and promptly receive any needed mental health care. Tenants with mental health challenges report progress toward recovery since entering supportive housing, and tenants would strongly agree with the following statement in this outcome. Staff helped me obtain information I needed so that I could take charge of managing my own illness. The final outcome, outcome 5, tenants have social and community connections. Housing helps tenants to develop connections to their community and build social support networks. Tenants are active community members who choose to participate in organizations such as faith communities and peer associations, and/or in activities such as volunteering, voting, community gardens, or block parties. Tenants report a strong social support network in this outcome. Next slide, please. In order to help communities achieve the core outcomes in supportive housing through the Housing Stability TA, CSH can assist communities in three broad yet distinct categories: establishing or improving rates of exit from homelessness into permanent housing. Second is developing written standards, policies, or procedures to help rapid rehousing funded programs move individuals and families into permanent housing. This may include assisting rapid rehousing programs to align with widely accepted practices in a standardized way across the COC service area, and assistance in increasing utilization and expenditure rates of existing rapid rehousing resources. And then the third is establishing or improving innovative solutions to engage landlords and identify creative housing solutions in challenging rental markets. This may include developing a flexible housing subsidy program, whole person care program, increasing voucher utilization, housing navigator training, or recruitment strategies. Next slide, please. So how can CSH work with your community to improve rates of exit to permanent housing? Glad you asked. So we're going to go through a number of examples in these next few slides. So some households may only need a few connections to community resources to prevent a homelessness episode. If you can imagine a family of 5 being diverted from the homeless system altogether because a crisis support line or an emergency shelter attendant was properly trained and equipped to triage and link the household to valuable support and resources. Another kind of a flip example would be an example where in a homeless shelter that has very strict rules, requires multiple levels of compliance in order for a person to stay in the shelter, and yet the person is provided very little or sometimes no connections to stable housing options. So housing stability can be helpful in this, where we can be used to work with the community to help retool shelter operations in order to increase exits into permanent housing. A healthy system requires the strength of a high-functioning emergency response and coordinated entry system to support this so that when homelessness occurs, it is brief, rare, and one time. Next slide, please. So some more examples. Another example of how housing stability can support a community is by facilitating strategies to improve role clarification related to coordinated entry, outreach, case management, and housing navigation in order to ensure optimal use of staffing and resources. Care coordination is an important component to transitioning a person from homelessness into housing. Utilizing resources in California, such as health homes and Medi-Cal, to ensure vulnerable populations are receiving the care coordination that is necessary to manage medication and ensure continuity of care post-hospital discharge or institutionalization. Coordination of medical care can be a key element to ensuring stabilization and housing compared to an exit back into homelessness or cycling into high-cost systems of care. Next slide, please. So next, in our second category, I'm going to provide a few additional examples of developing written standards, policies, or procedures to help rapid rehousing funded programs stabilize individuals and families in permanent destinations. Ways in which a community can benefit from this TA include, for some examples, adopting system-wide policies and practices to implement an eviction prevention program, which can establish agreements with property managers and landlords to have a mutual understanding upfront and a common goal of keeping people stably housed. Using that goal and all of the work done, processes can be established in the beginning, so when incidents arise, the tenant and all partners involved can do everything they can to keep the tenant housed. Other resources can be a review of system-wide practices and policies related to rapid rehousing to ensure consistency and accountability, which supports program compliance, housing utilization rates, expenditure rates, and future funding decision practices. Training is also an important component in supporting housing stability. So communities may want to consider developing a training program that addresses turnover and the need for refresher training on key topics in administering supportive housing, to include the trainings on your screen listed here. Next slide, please. Other ways the Housing Stability TA can support rapid rehousing programs is by assisting communities with understanding how to leverage various California funding sources to pencil the need for robust supportive services, such as No Place Like Home, the California Emergency Solutions Housing Program, the Emergency Solutions Grant Program, and the Homeless Emergency Aid Program. There's a need for adequate services for service providers that are working with highly vulnerable populations. And so it's very important to leverage the health home programs for things like care coordination and tenancy support services. Next slide, please. The last category to support communities with addressing housing stability outcomes is establishing or improving innovative solutions to engage landlords and identify creative housing solutions in challenging rental markets. Some examples of this approach can be, you'll see some listed here, but developing tools and resources to advertise and engage landlords in order to develop a robust inventory of supportive housing units. CSH plans on developing comprehensive landlord engagement toolkits with important tools, desk guides, and resources for communities to use and replicate in various community settings, including urban, suburban, and rural. Resources to develop media campaign or strategies for identifying a community champion to advocate for landlord engagement are all strategies that CSH can use to work with communities to increase the housing stock and portfolio in a given community. Next slide, please. This example is one that we wanted to provide as an example of a successful landlord engagement program that CSH has been involved in, which is the development of the Los Angeles Flexible Housing Subsidy Pool. It provides a rental housing subsidy that is paired with support services for LA County's most vulnerable homeless populations. It was launched in 2014 by the LA County Department of Health Services, the FHSP. It's financed through a combination of both public and private funding. Ways in which a flexible fund can be beneficial to a community is by providing critical, stabilizing, non-traditional supportive services that other funding may not cover, utility assistance arrears that can be a barrier to folks entering housing, and a gap fill to cover the difference in rent, capital development and operating support to assist with the development of new supportive housing. Next slide, please. Sorry, I guess that was the end. I just want to say quickly, the Housing Stability TA, as you might imagine, is quite broad and covers 3 very distinct categories that are intended to support getting people housed and keeping people housed. So we're really looking forward at CSH to working with you on these goals. And now next to Homebase.
Hi, thank you so much. This is Jean Field, and I work with Homebase. And we are a California-based technical assistance provider, and I personally have had the pleasure of working with many communities in California, both some of our largest communities, as well as our most rural and remote communities through our Northern California homeless roundtables and our Central California homeless roundtables. And so we're very pleased to be able to work with HCD to provide this technical assistance. I'm going to go through my slides very quickly, so we'll have time for questions at the end. But really, the purpose of this technical assistance is to meet the needs of your community, as Kathy said, and to really tailor the kinds of help that we can give to the experiences of your community. So next 2 slides, please. Great, and you can forward to the next one as well. So you've heard from the other consultants here about some of the ways that they're able to strengthen the systems. And why is Housing First so important as part of that work? Well, first of all, it's the law. All California state-funded and administered programs must be Housing First. But moreover than that is it really helps increase system capacity by ensuring that systems and communities and every provider are serving the most vulnerable people in the community, which helps keep those people housed and frees up resources for those who maybe need less intensive services. Next slide, please. And what is Housing First? It removes the barriers to housing and retention through recognizing that homelessness is a housing problem, first and foremost, and should be treated as such, and that people should be stabilized in permanent housing as soon as possible, and that because all people experiencing homelessness are ready for housing. And that the things that may be contributed to a person or family's homelessness are best addressed through housing stability and once that person is housed. Next slide, please. I think most providers in California are familiar with some of the characteristics of Housing First. Few or no barriers. That means accepting people regardless of their sobriety, for example, or regardless of how well they are working through their case management or other interventions. Reasonable accommodations, identification of alternatives, meaning helping the client decide and focus on what their housing alternatives are and making those work for that person. Those services are voluntary. And also examining your system to make sure that you are putting in the appropriate supports in terms of flexible payments, helping people avoid eviction, working with their strengths as well as their weaknesses. Next slide. So first and foremost, we know that many California communities have already endorsed Housing First, certainly in their COC and state-funded programs, but we also know that endorsing it and even writing policies about it does not make it actually work in the community. And so we've come up with some ideas for helping you identify how to make those policies a reality and how to support your providers in implementing Housing First. And those essentially are establishing a clear vision, making sure that everyone in every agencies, from boards of directors, leadership, elected officials, down to the line staff who are working with people every day, understand and support the vision and have tools to incorporate Housing First practices in everything that they do. And then make sure those practices are memorialized in policies and procedures, and make sure those are communicated and so that they are clear and easy to implement. So the next slide, and you can skip these second ones just for time. But again, we just want to make sure that we can help, that your leadership is on board with the Housing First vision and mission. Sometimes there's a lot of misinformation or fear in the community, and so making sure that the community members who support your organization and your continuums of care are also understand what Housing First means and that it really is an evidence-based practice and something that will be helping people. Next slide. Making sure, as I said, that the agency's vision can then be implemented into principles using data and feedback from staff and the community. Next slide. And we also, as Kathy mentioned, can help you write policies and procedures. We can help you review the policies and procedures of your continuum, your departments, your agencies. But more than that, we want to help you make sure that those policies and procedures reflect the work that your community needs to be doing. So we're using a change management approach for every step of the way. So just looking at the policies, getting feedback, meeting with staff and clients to discuss what those policies look like in your organization, posting them, revisiting them, and tracking the numbers. Are fewer people being turned away? Are people moving into housing at a higher or faster rate? Next slide, please. And the next one. And very briefly, we feel that there's important to have ongoing feedback loops while you're changing the culture around Housing First. It is important to acknowledge what staff is experiencing, the changes that are going on in your program, and communicating those throughout the program to come up with solutions together. Next slide. And I think that it's important to acknowledge that there are different messages and different ways of communicating with different components of your community. So for example, some people really respond to social media. Others, it's an in-person conversation that works. Some folks really would prefer to have a phone call, and to just acknowledge that your message to landlords may need to be communicated through a different forum than your message to organizational leaders or your program managers. Next slide, please. And the next. Just briefly, I want to touch on the fact that it's very important that staff are endorsed and are engaged in Housing First practices. And that means not only do you have to hire and train the correct folks, but also support them in a trauma-informed culture. Next slide. When you change your policies and when you change your means of doing the work, those staffing structures might change. The roles of staff may change, and so it's important to assess, are we organized in the best way to help our staff serve the people that we want to serve? Next slide. And again, thinking about the members of your team and how they're engaging with clients, how they're provided training regarding their client-centered trauma-informed skills, and also supporting them on their journey in terms of helping other people deal with the housing crisis. Next slide. And the next. Now, one of the ways that this process works and that technical assistance can help is helping you make sure that the changes that you've been making towards a more housing first community are working. So making sure leadership is on board, training supporting staff, gathering feedback from staff and clients, and providing toolkits and evaluation tools to measure progress. That's one of the things that we're going to be providing for everyone throughout this technical assistance. I think it'll be open to all communities, but we can also tailor individual program and community tools. And then tracking the numbers. Are you serving the people that you had hoped to reach through this new work? Next slide. And the next slide. I think this is an important slide because change really is a verb, not a noun. This is an ongoing process ensuring that Housing First is implemented throughout the community, and it's not a one-time endeavor. Next slide. So how can we help you? Again, we're going to have a variety of tools, toolkits, evaluation strategies to identify the barriers to full implementation of Housing First in your community, targeted training for community and agency leaders, line staff, individual agencies or program type. We feel that peer support and peer learning is a really great tool. Converting and creating barrier-free emergency shelters, outreach, diversion, and problem solving in housing systems. Reviewing and drafting those Housing First policies and procedures and putting them into practice at every step of the process. But first and foremost, we want to hear from you about what does your COC need, because I think in most communities, you know, and just need some help putting that into practice. So thank you.
Thank you, everybody. So now you have heard from all our technical assistance providers. I mean, as you can tell, they're experts in their field. And again, we're looking forward to hearing from you. We're also looking forward to, we'll also have every one of them in one room, in one location, in Merced, in Sacramento, and then also in Oakland. So right now, I would like to take the opportunity to answer some questions that may have either come in through the chat section, or if folks have that pin, then they could be able to ask the questions to any one of the panelists.
Kathy, no one has their hand raised at this time, but we do have a few questions in the question box. Do you want me to read them off, or do you want me to send them to you? How do you want me to do it?
If we could just maybe have maybe 5 minutes, and we can just maybe read off a couple of questions, and then the rest we could be able to put together in a frequently asked questions, and we could answer those questions collectively.
Sure.
Yeah. Okay, so the first question is, can we ask for specific assistance on housing homeless people with current meth use? Implications for possible contamination of units by people smoking meth, also effective methods of intervention, property management in sites that are shared housing, difficult to monitor for safety since they each have separate entrances.
So under the housing, so if you're seeking that type of assistance under the housing stability, you would request a technical assistance through the housing stability. That's what it feels like it fits. But then again, once you submit your request, we will evaluate to see which technical assistance consultant is appropriate to be able to help you.
Great. So next question, is our coalition eligible for financial assistance to update our 10-year plan, or could HCD provide a consultant to do the plan update?
When you say coalition, I hope you're talking about your COC for your service area, and yes, our technical assistance providers will be available to help you update your 10-year homelessness plan. In fact, we're doing it right now. In fact, we're helping Butte County, Central Sierra right now, and then Inyo and Monroe counties update their plans. So if this is the type of assistance that you're seeking, we can be able to offer it. If it's, again, for your COC, but not for a coalition. If the coalition means COC.
Okay. Is there a charge for this technical assistance?
No, absolutely not. This is at no cost to you. These funds are from the ESG and No Place Like Home technical assistance set-asides. Just send over a request, and we will deploy someone to your jurisdiction.
Great. I think that's all of the questions with specific content that we're seeing. Let me see if there's any hands raised. No. Okay. Okay. So unmuted. Martin Talea.
Taralay. Yes, Taralay Martin. Can you hear me?
Yes, we can hear you.
Okay, perfect. So I just went through the seminar and the technical assistance. So we're a nonprofit, and we deal a lot with rapid rehousing, and we do have permanent supportive housing. We have a few houses, and we deal with a lot of vets. So we've been in business for about 40 years, and so the technical assistance program, I mean, we would like to, I kind of heard in there that you revamp some of the policies and procedures, as well as getting resources available. I guess our biggest, what we need the most assistance with is finding permanent supportive houses that we can manage, because we have case management in various different languages and our applications in various different languages required by HUD, but we can't seem to find enough houses to set up our permanent supportive program within them. So I guess that would, what other resources do you help with resources in trying to communicate with the landlords and build these relationships with landlords? Because our RH program that we do is basically a one and done. We provide them with the assistance, and they come back if needed, but we do have the case management involved, but we don't ever build relationships with our landlords, and it's something that we fall short on. So how would you be able to help us in building these relationships with our community and the landlords to build more permanent supportive houses?
Okay. So under the housing stability, we would ask your continuum of care or your county to request assistance on your behalf or on the behalf of your continuum, because obviously as a provider, you're not the only one who's experiencing this issue in your service area. And what we could be able to help you is under the housing stability, we could be able to help you maybe look at a marketing campaign so you could have a way to engage your landlords. Maybe creating a toolkit, a communication toolkit, so we can be able to have to attract more landlords to help folks who are experiencing homelessness. I know that we have been in Tulare County where they had the Housing for Heroes campaign, had the same issue. We had our director come in and unveil that program. It's something that we could again be able to replicate in your community. So what I do ask is that you work with your continuum of care, or you work with your county who's eligible to submit the form and then request for the housing stability technical assistance.
Kathy, this is Kate. Would it be okay if I gave a couple examples?
Oh, go ahead, please.
Yeah, so thanks for that question. And as Kathy mentioned, I think we hear that a lot all around the country as well, in addition to California. I think the flexible funding pool and talking about that might be an option, which I referenced earlier. But specifically around landlord engagement, some items that CSH has found successful in the past and currently, we've done things around an annual summit where you gather landlords and talk about the different needs in the community and all sorts of things like that. And that has been, if you choose to submit an application, we can certainly talk through that and what that might look like in your community and if that's a good fit for you. We could provide education around what supportive housing is and isn't. I think a lot of, not just providers, but a lot of landlords have misconceptions about what that really means and what their role in that is or isn't. Also some, I think education around tenant rights is another big piece that can work well in places. And then some places, some things we've done in the past too are around developing a media campaigns, but for how we can promote supportive housing. So just a few different ideas that are not one size fits all, but different things to kind of chew on.
Okay, perfect. Thank you.
Thank you, Sixty. Okay, it looks like we do not have any other questions via audio, but I really would like to thank every one of you for attending the webinar. We look forward to seeing you in any one of the locations that we have advertised. And if you have any questions, again, please let us know. If we go to the last slide, please. The next slide. And this has all our contact information, so you can email us at homelessnesspa@hcd.ca.gov. I review all the emails that come through that email box, and then again, you can be able to follow us through any one of our campaigns through social media. Again, thank you, everybody, and if you have, again, any questions, we look forward to seeing everyone in the field. If you have any questions, please let us know. Thanks again.